Well, they're a big part of helping keep Allen County healthy and get them active. Activate Allen County. And joining us today, Co-Director Josh Unterbrink to tell us about the big Stakeholders breakfast that is coming up and things that will be coming out through this breakfast. So thanks for joining us, Josh.
Yeah, thanks for having me this morning, Holly.
Okay, so you have lots of partners and you guys work together and you do have plans and you try to use tools and things, right? And part of this breakfast on May 12th, right? May 12th, yes. You're going to talk about that, right? Tell us more.
Yeah, so our Community Health Stakeholders Breakfast on May 12th is really a great event that we're trying to bring as many key community stakeholders from around our county together to talk about our community health improvement plan. We're going to get an overview of our recently completed community health assessment. And then we are announcing a new resource that's really exciting called the Allen County Health Atlas, which is an online tool which allows anyone in our community to really dive into health data around our community and pinpoint, exactly what they might be looking for when they're applying for grants, and a really great tool for government agencies, nonprofits, for-profits, and citizens in general. So we have a lot of great, exciting announcements to come out at that breakfast on May 12th.
When we talk about this breakfast, from the look at the speakers, you do try to bring all different aspects of the community together to look at this and look at this health issue.
Yeah, because there are so many key partners that really come together for this. So every 3 years, we conduct a community health assessment, which is led by Lima Memorial Health System, Mercy Health, Allen County Public Health, the United Way, the Mental Health Recovery Services Board, and then, like you mentioned, Activate Allen County. And this data that's collected through the assessment is used to help create our CHIP. So many different organizations, citizens, and individuals really help build that chip. And when we're looking at our community health assessment, the community plays a huge role in that. So anybody in Allen County that completed a paper survey, I want to say thank you for being part of that process. Anyone who came and participated in a community conversation, your voice was heard and you've helped add to this conversation and this plan. If you attended one of the Activate Allen County block parties or a Healthy Families Expo and completed a survey, your information, the things that you answer for us, helps guide the decisions that are made to impact all of our community health. And so, like you said, Holly, we have a lot of key stakeholders coming to give remarks at our breakfast, from Bob Cupp, Rhonda Lehman, Tammy Cologne, Sharita Smith, Jed Metzger, Jeff Utz, Brandon Fisher, Kayla Montfort, myself, and others. So we have a really jam-packed morning, and the public can view this event on Activate Allen County's Facebook page starting at 8 a.m. on the 12th. So if someone is interested and they want to see what's going on, I'd say jump on Activate Allen County's Facebook page that morning, find out what's going on, and then we have a lot of opportunities for folks to join the work. We have work groups and different ways that people can volunteer and get involved in the great work to make our county a healthier place to live.
Were there some surprises maybe in some of those results, or when people turned in the surveys, or you got feedback that you're like, wow, I guess we do need to work on this area more, or, maybe this area is not as bad as we thought?
Yeah, I think what we've seen is the pandemic really had an impact on our weight, our ability to be active, to eat healthy, and to be mindful. So I think there are some surprises in there, and I think there's some surprises that actually show that we're doing better in some areas than we thought we were doing, and then other areas we're not doing so well. And so, our document that we put out for a community health assessment is over 170 pages long. So it's a lot of information. So I like to really, look at the things that we can impact, but we're gonna dive into that information on May 12th. All that data is embargoed right now, so I can't really talk about some of the key findings, but I can say, in some areas we're doing great as a county. We have some room to improve in some other areas, but I think we have the right people, working together, and I think that's what I'm really most proud about here in Allen County. And what is most, positive is that we have so many people willing to, put personal politics, business aside, and come together for the greater good. And so, whatever challenges befall our health here in our region, I believe that we have the right people, gathered to take on the charge and make some big changes.
Right. Some people could think, it as a negative, like, well, we have these things to work on. But as you just pointed out, there are people that are committed to working on it in the community to improve that area, whatever you talk about at the breakfast, to make improvements and make it better.
Yeah, that's right. So, sometimes we get surprised by the data. A lot of nonprofits, government agencies, we're working every day on the task at hand, and sometimes we lose sight of the next big issue that's coming. And I'll use one example that we hear a lot of recently is opioids have been a big issue locally and nationally for a number of years. But as opioid use has really got a lot of attention, and we've done a lot of good work in that area, there's been other drug usage rates start to creep up. So we're seeing methamphetamines being used a lot more in our region than we have in the past. So as attention has been really and a spotlight's been brought on opioid use, now we kind of need to draw that attention on some other issues in our community. So it's a matter of keeping the issues at hand in focus, but then also knowing what's coming up ahead and making sure that we stay ahead of those other epidemics and issues that could catch up with us if we're not looking at the data and paying close attention.
Yeah, this breakfast is going to be really exciting with great information. May 12th, again, follow on Facebook. Josh, thanks for joining us today.
Thanks for having me, Holly.
All right, don't go away. New Edition continues in a moment.
Donations